everyone. Welcome to Crosstalk. In today's episode, we are talking teeth, care, and everything in between with a dedicated dental hygienist. From daily routines to patient tips, get ready to learn what really goes into keeping your smile healthy. Let's get started and welcome Ashhisha Balchandani. Good morning. Hello. How are you doing today?
I'm doing well, Ekta. How are you doing? Thank you for having me over to Crosstalks.
Thank you so much for agreeing to come here. Your profession looks pretty interesting to me. Tell me, what do you do? What is this dental hygiene all about?
Well, it is something that you will always see in a dental office, and I've been doing this for the last 5 years now in Canada. And back home, dentistry has been my passion, so I was a dentist back home.
What do you
Yeah,
really
hi.
enjoy about dental hygienist?
The fact that I can provide the dental care for my clients and see them smiling and they come in with, some tartar on their teeth, and the fact that I can, help them achieve their white smile, makes me happy. While they are in the clinic with me, I do talk to them about how their brushing techniques are, what their oral hygiene looks like. Do they floss or do they, use mouth rinses? So in the clinic, we do go with educational equipments we have. Then we have demo videos, and that's how we train them about dental hygiene.
Uh, why visiting dentist and getting this hygiene thing is so important for everybody?
Why is it important? Because it's our body part, right? And just like we go for annual body checkups, we have, cholesterol checkup, blood checkup, or we have LFTs, hormone checkup, everything that you do in the body.
Yeah.
But why not teeth? Isn't teeth important?
Hmm.
So that's the reason why you should go for an annual checkup and get your teeth cleaned, because there's so much that you can do only. The rest is what the professionals take care. You brush in the front and the back, but betweens you forget. Like you don't forget, it's the floss that you don't do many
Yeah.
times. And you just ignore it, and then that's the build up. That's why I say that it's important.
And if you keep ignoring that for a long duration, what will happen? Or what happens?
So first, gum recession,
Hmm.
root exposures, sensitivity,
Hmm.
cavities.
Oh.
It could lead to root canal treatments if you've not taken care, because the bacteria is seeping into the teeth.
Hmm.
And then you have to go in for a cavity filling, you have to go in for, root canal treatments. Sometimes it's so bad that the root has gone down so much, the gum has gone down so much, the teeth is mobile. So it's very important that we take care of our teeth.
And how do you educate patients on oral health and hygiene?
So when they visit us, or even, when I meet people and I see that there is something that their health needs, that dental health needs concern, I do address it in a very, subtle manner. Because if I jump onto them and say, "Hey, your teeth need cleaning," they'll probably, back off and not talk to me. So while doing their, treatment, I do before and after pictures and show them their health of the teeth and the gums, and then we tell them why is it important. I show them demonstrational videos about how to floss. I
Hmm.
demonstrate in my clinic dental flossing techniques, what we use over, the threads, the picks and everything. We guide them there. And if someone has issues with brushing techniques, because sometimes people are very aggressive, we tell them why is it not good to have aggressive teeth brushing.
Have you ever encountered any such patient where the patient has refused to get the treatment and you had to convince the patient and you were successful?
Well, it's very often. Many people from back home have this mindset that we don't need to clean our teeth because that's unnecessary, right? And that's where I come in to explain them that the reason why it's not, seen in India or back home anywhere else is because there is not much education and awareness about dental hygiene. Now,
Yes.
when we come to the Northern America, countries, Prevention is better than cure is addressed really hard on everybody, be it health, be it, any other wellness. So I've had a client where he's like, I don't need it. But I sat him down, showed him a picture of a client who was before and after. So these names are not declared, it's a confidentiality, but we have consent to take pictures and show it for use it for educational purposes. So we use that to address it to them, and then they do get convinced. And rare is a situation where I've ever seen them, actually say, no, I don't want the treatment.
So it's not only being a dental hygienist, it's also, kind of handling those different kind of people in your everyday life. Sometimes you can also come across somebody who's nervous, somebody who's violent, somebody who's aggressive. So it's about
Yes.
meeting all kind of people in your profession.
Yes, yes. We do meet a lot of clients who are very stressed out for, dental hygiene. Many of them don't like the noise of the equipment. Many of them have the fear of injections. So our clinic basically takes care of all these needs. We have a spa-like treatment available where music is very soothing and calming. And the fear of the dentist is not there because I don't work with a dentist. I work independently, and because I go home also to provide the comfort care. So there's rarely a situation where we go into a situation where they say, "Oh, I did come in with a fear," but then they left so happy and so stressed free that they're like, "Oh, I did not anticipate this."
That's very interesting. And
Yes.
talking about career, how is this as a career, and what do you advise to the coming generation?
So this is a very interesting career, I would say. It's a diploma program that is offered to students 18 years and above. So once you've finished high school, you can actually enroll for this program. It is fascinating. Someone who loves teeth, who loves the body, and is looking for a quick course. Um, there are two routes to go for it. One is through a 3-year program, and then there is the diploma program that is 20 months. So either or, there are options available, and I strongly encourage everybody who has the passion for serving, people should opt for this industry. I absolutely love it.
And you said you have your own clinic. You don't work with a dentist.
No, I don't. I decided to step out of the dental office and start going to senior care homes, elderly people homes to provide the dental care. And once that picked up, young families who are very busy and cannot come to the dentist, waiting in the office gets to a point where you're like, oh my God, dental appointment, we can't go because kids have their activities, husband has his work, she has her kitchen work. Some females reached out to me and would you come home? I'm like, absolutely, I'm here to provide that care. Four of you coming to me versus me coming to you makes it better. So I travel across GTA as well to provide care right in the comfort of your home.
That is very interesting. That is awesome.
I'm thankful to you for, bringing that awareness to everybody and having me over. It's a blessing. Thank you.
Any message for the people who ignored their teeth?
Well, you know what? Ignorance is not good. Awareness is very important. And I would always say that if you have healthy teeth, your smile is always going to be, healthy. Imagine me with one teeth missing. How am I going to look?
Yeah, it makes a
Right?
difference.
The first thing that a person sees when he sees you is your teeth, your smile.
Yes.
They don't see the eyes, they don't see the nose. It's always a smile. That's why, girls like using their lipstick, or, men also, make sure their lips are, not chapped, because in a professional environment, the smile talks a lot.
Yes. And your
So
smile makes a big difference in your appearance. So having a beautiful teeth is one of the most essential. From my point
yes.
of view, yes, it's the most essential and the
Yes.
most beautiful thing.
So if you are interested in getting a whitening done where you want to see your teeth more whiter and brighter, always reach out to a dental professional who can help you into this. Don't try home remedies. Like,
And
mm,
is this procedure safe? Like,
yes, it is. Yes, it is. It is because it's assisted by the dental professional, be it a dental hygienist or an assistant or the dentist in office. It is very, very safe. I do it for my clients at their home. So I take my entire cart and I do it there. Also, I'd have a few clients doing that.
yeah,
These days, we have a lot of,
yeah, a lot of, see, all these celebrities, these film stars, they're regularly going for whitening.
yeah, cosmetic treatments are all over the place. And it, it's just that there is not much awareness of what all
Yes,
can be done. And it's always in the mind that, oh, it's going to be expensive.
yes.
Uh, It is available now to everybody. With the Canadian Dental Care Plan, that is my most important topic I want to address to everybody.
This
That
was my
guys,
next question to you. That how can people like do? Is the government covering? Is the government sovereigns, serving this, supporting this?
yes. So now this is an important topic that keep advising everybody who doesn't have dental insurance that if your salaries are, um, as a household income is 90K, and you've registered your taxes and your NOA should have a line which says you are eligible for the Canadian Dental Care Plan. Now, what is covered in that? Dental care is covered, cavity fillings are covered, to a certain extent, root canals are covered, even our extractions are covered. The
Yes,
entire disease process starts from the mouth. What we eat goes down. So why wouldn't it get stuck here?
yes. Yes, absolutely. Thank you so much for this insight. And that's wrap on today's episode of Crosstalk with me. Big thanks to my guest Ashhisha Balchandani for sharing her journey and shedding light on the vital role of dental hygienists. If you find this episode helpful, please don't mind helping and sharing with others. And stay tuned for more conversations that matter. Until next time, keep smiling